I'm Michael Kenneth Williams. I play Omar Little on HBO's The Wire. That's television. There are some real life issues facing Baltimore. Did you know that 74% of the youth population are African American? And 97 to 100% of the youth that's locked up are black males. Racial disparities do exist. Community programs and rehabilitation are key. Let's focus on our youth. Rewrite the script and make a difference. Visit flbcinc.org. Check out DMC.
Casey Cares has been here ever since the beginning. It's like a second family. They offer a lot of support, the good times and in the bad times too.
A group like Casey Cares can bring some happiness to him. It means a lot to him, you know. It makes his life normal.
Their name says it all. They really care about your family.
We founded the Casey Cares Foundation in 2000 because there was an unmet need in the community. We pride ourselves in serving not only the critically ill child, but the entire family. We also start at birth to age 18. And how we went about developing our programs was going to the physicians, going to the social workers, going to the parents who have critically ill children, and going into the field and saying, what is it that you guys want? What is it that you believe your patient or your child really needs? And after having numerous conversations with them and finding out what they truly need is how we establish the mission of the Casey Cares Foundation, which is to provide uplifting programs with a special touch to critically ill children and their family members.
Bon Secours health system is involved in the health of the communities. You have physical health, you have the economic health. And here in Baltimore, if we look at all that we're doing and what we do from the outreach center, we are meeting the needs of the people.
Mission indeed. In the deeds around housing, the deeds around helping people to build wealth in the sense of savings account, home ownership, help with educational issues.
We are a health system that's viewed very positively in Catholic health care, and it's because of the people who work with us. And then hiring the people to work in our ministry that have compatible values with Bon Secours.
A lot of times people come in the hospital stressed. They don't know what they're coming up against. But when you give with love and the care that Jesus shows us, then they're able to take that away and say, oh, I want to go back there to be treated.
My blood level had gotten low and I needed a transfusion. I didn't really think I was going to make it. But through God and my Dr. Anthony Joseph, I'm here to talk about it today.
Quality, compassionate care is manifested in several ways here at Bon Secours, Baltimore. There's our emergency room services, which are highly utilized by members of this community. There's our behavioral health program, which is very comprehensive, inpatient and outpatient. There's our renal dialysis unit, where we care for people with end-stage renal disease. And then there's our intensive care, which is where we have the robot that provides services 24 hours a day.
Associated Black Charities, a nonprofit umbrella organization, was founded in 1985 to provide funding to viable health and human service programs throughout Maryland. Our mission at Associated Black Charities is to represent and respond to issues that are of special significance to the African American community. Many important and worthwhile initiatives fail because of lack of funding. We use monies entrusted to us by you to ensure that these programs concentrate on key issues and are able to affect change in our communities. To date, Associated Black Charities has provided approximately $5 million to over 260 programs. This support goes directly to organizations that maintain a keen focus on 4 areas critical to the survival and advancement of our communities. They are family preservation, community revitalization, youth development, and economic empowerment. Family preservation. Without strong African American families, we cannot have strong African American communities. Today's family structure is one of a non-traditional makeup and requires non-traditional methods of support. In an effort to strengthen and revitalize weakening family structures, Associated Black Charities has taken an active role in determining which support mechanisms and programs are most needed. One very effective program is the Marion House. The Marion House is a residential, counseling, and employment program for homeless women.
Marion House is committed to family preservation, and mainly through offering women a real chance, not just bed, bread, and a Band-Aid, but a real chance to get themselves together and get together with their children and stay together with their children.